So this is the pediatric firm body kit. We have in the kit we have two pediatric esophagoscopes, rigid esophagoscopes. You will find numbers on the esophagoscopes. So both of them are 20 centimeter in length, and then there you will find two numbers, 10 by 14. That would be the 14 would be the width and 10 would be the length, and similar to this one you will find it 12 by 8, so that would be the space, your working space. You can see there inside, there, can you see the groove there? That would be for the light source to go in, so the light source should fit and slide through there, and then it can be fixed inside this hole. And you will have the optical forcepses. So there is the peanut forceps, which has a groove inside it, and then you have the coin optical forceps and the alligator optical forceps, and another alligator forceps that's not optical. Optical means that essentially we can fit the optical lens, the Hopkins rod inside. So to slide it in, you just essentially slide it in, and for it to be fixed, it has to fit inside the groove. So it fits inside the groove that is built for that, okay? And to lock it, it just needs to go, it just needs to go vertically, so it does not go off like this, does not come off, okay? So everything is set up vertically, yeah? So that is our foreign body kit, but if you have a foreign body in the airway, you essentially need to open the MLB kit as well. For the esophagoscope, there are two ways to insert the light source. The other way would be through a prism light carrier, and that goes directly inside the esophagoscope. But if you go all the way, you can see that the prism is occupying part of your lumen, so it needs to sit on the first click when you need to insert your optical forceps inside. But to have a better light, then sometimes you just have to put it on the second one. So this is our pediatric MLB set. You will have assortment of pediatric ventilating bronchoscopes, starting from size 2.5 and to 3, 3.5, 3.5 of different lengths. So either 30 centimeters or 20 centimeters. The smaller ones, you normally will find them only on a shorter length, but anything from 3, size 3.5 and above, you will find them either, you can find a shorter length for which ventilating bronchoscope that you're going to use, and then you have the size 4, 4.5, 5 and 6. All of these are available in our MLB set, so which one to use depends on the age of the patient and whether you are anticipating some sort of narrow airway, subglottic stenosis. If you are anticipating some issue with the airway, you always go either half a size or a size down to what's expected. So these are our ventilating bronchoscopes, and we have our laryngeal scopes. We have the Lindholm and we have the split Lindholm scopes, and this is the suspension. After assembling it, it comes into three parts essentially. It comes with a screw and the suspension. You just have to set all your equipment up beforehand. So now when you come to the ventilating bronchoscopy set, essentially what you need is that you need to assemble the rigid ventilating bronchoscope. Okay. And now to set up your ventilating bronchoscopes, there are many kind of working channels or utilization channels in a ventilating bronchoscope. So this is the main working channel. This is where your optical forceps or the Hopkins rod goes into. And to make everything fit in place, it has an adapter. If you can see, the adapter has a notch here and a notch there, like a lock and key model. So this adapter needs to fit in directly into the ventilating bronchoscope notch. And then you will see that there is a lock to the ventilating bronchoscope adapter. We keep it unlocked first, and then we slide our Hopkins rod inside the ventilating bronchoscope. So if you can see, it does not really fit this way completely fine, but because everything needs to be facing up, so the lens needs to go up. So as you can see, now it just fits perfectly. And to make it lock, then this lock also needs to go up. So now everything fits up nicely, okay? But if you can see that when I faced it down, it does not really face correctly and does not lock. So everything needs to be facing up, and once it's facing up, everything locks nicely. So this is the how to set up the lens on the ventilating bronchoscope. If you can see here, this is where the airway is attached. So this is for the anesthetist, and then you have another hole just across from that. And if you think about it, if you keep this hole open, all the air is going to escape through there. So we have a prism, light prism, that we can use as a light prism, or just to essentially plug this hole, yeah? And as you can see, there are two levels of locking this hole. If you keep it at number 2 there, sometimes when you pass your optical forceps, that essentially stops you from going inside, so you can keep it at number 1, okay? So the main purpose of it is just to prevent any air leak, and the anesthetist can ventilate from this side. As you can see, there's always also a suction channel. For this suction channel, also the air is going to leak out, so you have to seal it with this adapter. And as you can see, there's a number 0 there, and there's a number 0 just opposite to that, and that's how you make it lock as well. For locking that area, either you use this rubber band just on top of that so that it seals, and if you can see, there is a tiny hole in there that we can pass the spaghetti suction through. Okay, so this is how you set up your ventilating bronchoscope, and you can set up any of the ventilating bronchoscopes according to the size and age of the child, as mentioned as well. If you anticipate any stenosis or narrowing in the airway, you go a size or half a size down. If I need to use the optical forceps to grab a foreign body, then I will need to remove the lens with the adapter completely out, and I'll just have the airway. This side is blocked with the prism that we're not actually using, and then I go in with my optical forceps, which I also set up everything pointing up, so it locks nicely, and then you go inside the inside the ventilating bronchoscope. As you can see, you can now function inside the airway with the ventilation running, and you're safe to grab your foreign body, come out. Sometimes if the foreign body is bigger than your bronchoscope, then you will have to come out as one piece completely outside the airway, and then you reintroduce yourself again and have a look and see if you need to remove anything else. Thank you.